Hello everyone, this is Dr. Prithpal Singh Matija. I am an MD pharmacology from CMC Ludhiana, and last in one of the last sessions I started with the general anesthetics uh, under the CBME curriculum for undergraduate students, phase 2, where we talked about the competency PH 3.1, which says describe types, salient pharmacokinetics, pharmacodynamics, therapeutic uses, and adverse drug reactions of general anesthetics and medication. So, in the initial part of this particular presentation, we started with this particular aspect of what are general anesthetics, what was previous, how previous anesthesia was there, what is the difference between a general anesthetic and a what is the difference between a general anesthetic and a local anesthetic, why anesthesia is required, what was the purpose of this anesthesia, where we talked about the presentation where early amputation was being performed without any anesthesia and patient was quite in a lot of pain. This was followed by uh, a particular uh, phenomena in 1846 where Ethereal Dome is now a landmark in our medical history. The day was 16th October 1846 in Moshe's General Hospital, where ether was used as a general anesthetic and surgery was performed. Then there was discovery of various other elements such as chloroform, which was administered to the patient, but there was a difficulty in administering chloroform because this was a type of an open system where through the route of inhalation, a lot of other people could inhale the drug. So when we talked about this general anesthesia, we talked about it being a state of reversible loss of consciousness associated with analgesia, with muscle relaxation and reflex suppression. And these were some modern machines that we were talking about. As we go further beyond, advances keep on coming up, and now we have everything there. So anesthesia is no longer a dreaded procedure as it was earlier during the early 18th and 19th century. Now, the general anesthesia generally consists of a triad of three essential components. One is hypnosis, the other one is analgesia, and the third component in this is muscle relaxation. So, all these three components are essential for general anesthetics. So, the purpose or the way by which these general anesthetics can be given is either being given by the inhalational route or by the intravenous route. Now, once we start the general anesthetic by the inhalational route or the intravenous route, there are three phases by which a general anesthetic is given. The first one is induction, followed by maintenance, and the third one is recovery phase. Now, in the induction, it means from the time to onset of administration and development of effective surgical anesthesia. Maintenance is for a sustained anesthesia, and recovery is once you discontinue the anesthesia, the time taken for the patient to regain consciousness and elicit physiological reflexes. There's a thin line of demarcation which starts with amnesia, goes to sedation, hypnosis, coma, and finally leading to death. So the traditional anesthetics that we were talking about, they were given in high doses so that they reduced pain sensitivity, loss of consciousness leading to muscle relaxation, and there were paralysis of uh, vital centers. Now we use modern anesthetic agents where each anesthetic agent has a specific purpose, and this leads to lower reduction of doses of a particular drug. So for unconsciousness, we have a different set of drugs. For muscle relaxation, a different set of drugs. For autonomic stabilization, we have another set of drugs, and for anesthesia, a fourth set of drugs that is given. Then there is a particular term that is known as a balanced anesthesia, which is a mixture of giving drugs for pre-anesthetic medication so that anesthesia is no longer a deadly situation or a deadly experience for a patient. Then induction is smoothened enough. You have drugs that are good effect for maintenance, and once the drugs used are such, once it is done, the recovery is quick. Now, the stages of anesthesia are classically seen for ether, and that is one classical example where we have these stages of anesthesia. So, this is stage one is stage of amnesia or analgesia. Stage two is uninterrupted response to stimuli. Stage three is stage of surgical anesthesia, and stage four is stage of vital depression. The stage one analgesia is where you have induction of anesthesia to loss of consciousness. The eyelid reflex is gone. The pain diminishes, but patient is conscious, can hear and see you. Stage 2 is the stage of delirium or stage of excitement, which is characterized by uninhibited excitation. The pupils are dilated, the eyes is divergent, the patient is agitated, delirium, there is irregular respiration, and breath holdings are commonly seen. This is potentially dangerous because if you give anesthetic agent or if you perform a surgery on this particular stage, it could lead or it could induce vomiting, laryngospasm, hypertension, tachycardia, and
Now, what are the various techniques of anesthetic management or components? Most of these techniques are by the protein components. The first one, and then you commonly are talking about the pharmacological method, open up method, or the machine with the anesthetic machine. Now, as such, there is nothing known as an ideal anesthetic. So, an ideal anesthetic needs to provide an ideal situation for the patient, for the anesthetist, and for the surgeon. So, what would be an ideal anesthetic treatment for an anesthetic? For an anesthetic, the ideal anesthetic treatment as administration has a right margin of safety, does not affect the organ, it's highly important that you are required. You can always quickly adjust by adjusting the depth of anesthesia, which should change sleep, but it should not react to the for a surgeon, the surgeon is mainly concerned with three things he requires. He should be working, there should be a clear anesthesia, and
From the patient's perspective, now the patient wants it to be pleasant, he wants it to be non-irritating, there should be faster induction and recovery, and post anesthetic there should be no nausea and vomiting. So by far we do not have any such anesthetic agent which fulfills an ideal a definition of an ideal anesthetic agent.
uh, that now, what is the mechanism of action of the anesthetic? So these general anesthetics they tend to act mechanism. All of them are mechanisms. One of the mechanisms is the light channel, like channel, channel, or the hyperpolarization, another could be the sectors, target with inviting without stimulus. Or there could be the general anesthetic generator or the check that the center or the treatment around seven to the immediate function with the radiation seeking system. So these anesthetic treatments are regulated by the we always know. So for the conditional anesthetic treatments, and yes, other name in the intravenous, we have various categories. One of them sodium, or oxygen, and then we have pendulized things, which is overacting vitamins, such as diethylamine, we have anesthesia, vitamin, and we have low corrector amount with 29. Talking about the first aspect, we talk about nitrous oxide. Now, this nitrous oxide is non-irritating as a higher amount of oxide required. It has a good analgesic, but a pure oxide. Even 100% of pure nitrous oxide cannot. This is used as a calorie and other second gas effect and epoxy anything and but talking about the other drug that is there, the aeroplane that is used, aeroplane can be qualified in advance. When it takes iodine, pathway, we can sensitize the heart personally to have a future body in 6 months. The procedure of patient for the shadow of lower the chief and now most of the cytokines will be the same, but 20% of this is metabolized and distributed. It is only focused on a second protection and maintaining clearance. Concentration of 0.5 to 1. Go to the fluid and this but once you combine it with the right 95 action. Enfurane and enfurane has a problem for the females, whereas epifurane is the most potent drug, less soluble in it's a higher blood pressure, it has a lower toxicity, and it can easily adjust to the depth of the anesthesia. It does not provoke seizures, it is good for maintaining. This has a budget order in the patient surgery where sevoflurane restricted by the line and tomorrow. Now, when we talk about thiopental protein is a highly lipid soluble drug. It is a non-inflammatory drug, and it means and so the NSF effect is significant by the time and first the brain and issue, the amount of the brain and issue by here, it is metabolized by the liver, before the shaping and the the only only that is not something like Hyopenton is also used for control of hernia, analysis, and it can also be used for lot of like that functions. Propofol is another anesthetic treatment that is taken for healing of the tachycardia or falling and infection. This is now the first driver. It means and it is there are certain rejecting strategies that they can inform and technical questions some people happen. Not is not so hard. Vitamin A identity. Yeah, it acts on several study temperature. It affects the patient remains and the problem with the it is normally used for maternal surgery or for patients that are functional for asthmatics and possibly for bone vesicle patient. 29 is another drug that is a short acting this instantly okay. Mark patient 29 and 29 are protecting their and it is not combined with yeah. Then there is another term that is constitution. Here we have a monitored state of consciousness, the diagnostic and the drug system now, talking about the complications that we see here, malignant hyperthyroidism is a thing, and this will be taken care of treatment purposes, all of them, the disease, and solution, and there will be complication. And here to be following substitution of the heart pressure, patient will have this contains and also post anesthesia patient can be a certain function, vomiting, and better toxin. Now coming to another particular area that is the pre-anesthetic medication. The pre-anesthetic medication as a constitution is a drugs that are given prior the purpose is to use drugs so that anesthesia is released present potential action causes the amnesia and other potential conditions and acidity. So what are the various drugs like to reduce levels for a significant twice nine for the secretion binary or acid secretion that so this finishes the particular undergraduate topic or general message And I hope I some time the topic two sessions about it. And in case we have any queries or how you can write it down and we can talk about it. I hope